and this is to all presenters, so to all our experts, what is one piece of advice you would have for people who are trying to get back to their regular level of activities after the pandemic without getting injured? And maybe I'll just start with Dr. Emery. We'll start with you, Dr. Emery, and then Dr. Motada.
Thank you so much. It was great to hear everybody's talk. And I guess I would start with saying that my focus has been with youth. And so many of them aren't quite athletes yet. They're sport participants, and we want them to be survivors so they can keep playing throughout their life. So I think that we have some really great evidence around neuromuscular training warm-ups. I often talk about those as the low-hanging fruit. And I think that, taking a multimodal approach and really thinking about all the different targets for prevention. And in this case, coming back post-COVID, obviously load modification is going to be a huge component for many youth athletes. And I'll pass over to my colleagues such as Matt to talk more about that, and more specifics. But I think that really that would be important to think about the combined approach.
Thank you, Dr. Emery. Dr. Motadi, any thoughts on that?
Yeah, very briefly, take your time, understand what you want to get back into, and try and simulate that activity as much as possible in your training, and keep it simple.
Dr. Jordan.
I'm going to just to build off the concepts here a little bit. It's interesting. I teach a class at the university on a topic about this, and I go back to a guy named Captain Thomas DeLorme. 1945, he was a physician who was helping soldiers who came back after war rehabilitate, and he came up with this notion of progressive resistance training. And really, it's like figuring out where you are on the progression. So, we often think about this as being sort of like, having to like do more than you should, or where you left off, or how I looked a year ago. And my advice would be to really, meet yourself where you are today, with where you are, with what you've been doing. Meet yourself there, and remember that your body's going to respond as you increase those loads over time. A lot of times what we'll look for is like about a 10% increase per week is kind of the type of increase that we're looking for. Now with athletes, that's often really easy to measure. It's harder when you're doing it for yourself, but that's a rule of thumb. So if you're using your your Garmin watch or your Apple Watch, you might be able to kind of look from last week to this week. Am I sort of in that rough 10% increase over time? And I think my final point would be is that your body's going to let you know. So listen to your body, and the idea that you got to push yourself to that brink, to that failure point, the evidence just doesn't support that. So you can stay in that zone of kind of like an 8 on 10, 7 on 10 effort, and it's going to do lots of good stuff for you.
Thank you, Dr. Jordan. Dr. Minocha, a piece of advice for getting back to a regular level of activity after the pandemic without getting injured?
Sure. I mean, I agree with everything that my colleague said. I'll speak from my physiatrist hat, trying to just set achievable and measurable goals. So I like to have my patients have a little exercise diary and just look at what you're doing, like Dr. Jordan said. So if you're not doing anything, then a goal might be 5 minutes of activity every day. I'd rather that you're able to do something consistently and do it every day than try to go out for an hour run when you haven't been running and hurt yourself. And just gradually progress, as my colleagues have said.
Excellent. Okay, on to question number 2. And this is for you, Dr. Jordan. How can you measure muscle strength without all the equipment?
Yeah, good question. Well, I think there are some basic things that you can do. And I'll just give a really simple suggestion. Is a lot of times it's kind of two things. And I'll talk about the context of ACL injury. You want to have 2 strong legs, and you want those legs to be kind of close to each other in terms of their strength. So what I might suggest is that just as a part of your own training, measure your strength through the exercises that you're doing. You can measure your strength through, if we're going to a fitness facility, you're doing a leg press exercise, or you're at home and you're doing body weight exercise. You can measure your strength actually just through that exercise. It's a good way to do it. And I would also encourage you to measure on both sides to see that both sides of your body have a decent level of strength.
Very good. Okay, our next question is for Dr. Motati, but some of our other experts, you may weigh in on this. It's a two-part question. What is the new standard for recovery for a young adult, so say a teenager, after ACL surgery? So that's for the first part. And secondly, does recovery length and return to sport change after a second ACL surgery?
So very good and very difficult questions to answer. The standard of recovery is a moving target and depends upon a lot of different factors. But what we were trying to achieve is an understanding of how that person functions given the expectations they have. And we've been trying to develop an assessment tool for that, to answer that question. And nobody's really been able to have a clear-cut assessment tool to do that. So we're struggling with that. I can't give you a very specific answer, but it's a challenge. And as far as your second injury or second ACL reconstruction, which Danielle may have faced, clearly we advise people that they are at much higher risk now for everything. And as Matt put in his two buckets there with the red and blue balls, these are the facts that you cannot change. So I advise everybody to go slower and think about changing what they do, because they're clearly at a higher risk.
Dr. Jordan, would you like to weigh in on that, or?
Yeah, I can build off this a little bit. And Danielle, I'm gonna go back to one of the things I keyed in on your presentation. Again, I don't want to put words in your mouth. This is what I heard. Hopefully, it's accurate. But you sort of explained how you got back, and you just didn't have enough runway, and you felt like your timing was off. Like your knee felt good, but it was like the timing, the rhythm. Sometimes in the old school boxing term, they'd call it the ring rust, right? You can't shake off that ring rust that keeps you sort of away from that. And so my advice would be that when you've got a young athlete who's coming back after an injury, it's really easy just to focus on, let's say, their knee. Is their knee okay? But I think my advice would be is to remember that these transitions are characterized by both progression and regression, which means I could be doing good and then maybe I have a setback. So we've got to accept that. And it isn't just my knee, it's my whole body. It's my timing, it's my rhythm, it's how my brain works, it's how I'm going to interpret information in a complex environment. It's my speed. It's all of these other things that sometimes we overlook. And honestly, they take time. So it takes time. We measure this in many, many, many months. It's not a 9 months and I'm good to go. That might be just where your journey starts. And then you've got a runway of another 18 months to get yourself back to what we call getting back to performance. So you got to be patient and you got to be persistent and you got to see the whole system in that process.
Very good. Thank you so much. And our next question is for Dr. Minocha. Can you comment on injuries with other walking aids, such as knee braces and walkers?
Yeah, I'd love to, but the problem is we're not capturing this information or data. So knee scooters, I've had patients who've had bursitis at their knee. Those are the ones that people are using after Achilles tendon injuries or ankle sprains. There's not really a lot of reports on that. Last year, I published a case report of someone having a stress fracture in one of their forearm bones. And it was the first case report of someone having that with auxiliary crutches. I'm sure it's happened at some point in the past 100 years, but no one's reported it. So I think there just needs to be a better system in place for tracking these injuries. And so I've kind of explored opportunities through emergency departments. Is this something that Health Canada should be tracking? I don't know what the answer is. I'm open to feedback if anyone has any ideas or looking to collaborate in that area, but I think it is important. It isn't just that first injury, it's that second injury. But certainly with knee scooters, I've seen some of that. With knee braces, I see a lot of skin problems coming from that. And then the other thing to remember with braces, there is some studies that show when you brace a certain joint, you're affecting the biomechanics of a joint sort of proximal to that or distal to that. So if you're bracing the knee, it could affect how things are moving at the hip or at the ankle, and that can affect injury risk as well. So some other things to consider.
Thank you, Dr. Minocha. Dr. Emery, this question is for you. How does your research apply to seniors exercising? Does neuromuscular training reduce injuries in seniors participating in sports? Does it reduce injuries for even non-active seniors, so reducing accidents?
Yeah, that's a great question. And certainly lots of my colleagues have asked us to collaborate in that area because there really isn't a lot of research, but there's certainly some emerging research around falls prevention and the ability to reduce the risk of injuries in older adults. And certainly the principles of neuromuscular training and would hold around things such as dynamic joint stability. And I think that even in the absence of evidence, there's certainly supporting research in youth and in young adults and in athletes that would certainly suggest that type of program would be helpful, and certainly has been helpful in the context of falls prevention, particularly things such as balance training.
Okay, great. And what is neuromuscular training exactly? This question is asking, how does this differ from stretching or yoga or fitness classes? Like, does this fit with GLAD and the UFC joint effort program?
Yeah, so that was a lot of different things there, but around things like stretching and yoga would be more of less so around some of the, certainly in yoga, there'd be more balanced training. The neuromuscular training warm-up strategies are typically inclusive of balance training exercises, agility exercises, strength training, and an aerobic component in a package really set up as a warm-up strategy. But again, components such as this are used in many different training programs and really important in a number of different contexts for sure. The GLAD program specifically is targeting individuals who have arthritis and pre-arthroplasty, and a lot of the principles around neuromuscular training are a part of many of the exercises that are part of that program as well, which is shown to be effective in delaying the surgery in many cases. So.
Great. Thank you so much, Dr. Emery. And now a question for any of our experts or all of you is, in order to prevent injuries and to rehab properly, what are the activities that you recommend to keep tissues strong and flexible? Who would like to take that? Since we're in this virtual platform, it's hard for me to just look over at you. Dr. Jordan, would you like to take that one?
Sure. Yeah.
So any activity that you would recommend to keep tissues strong and flexible?
I think so you probably already saw from my presentation that I think progressive resistance training is a great thing to put into your training. These would be things like, and it doesn't just have to be, lifting heavy things. It can be, there's lots of ways that this can be done at home. This can be done, safely. So certainly that's an element that I would strongly endorse. And I think that the science also supports that. I think that there is also a good amount of science just for, your overall work capacity. And I think this is sort of one of the tones that have come through the theme here this morning. And I love Dr. Matati's envelope of function from, I don't know his first name. I know the last name is Dai, because I actually have used that many, many times in the context of sport performance to talk about kind of understanding what your envelope of function is and how do you expand that. And I think this is where, cardiovascular exercise, whether that be, the low intensity type work that we do. And, if it's safe to do so with athletes, we certainly use more high intensity methods like high intensity interval training. But building up an individual's work capacity is another key part of the puzzle. So that's a couple of perspectives from the sport performance world. And I'm curious to hear what my co-presenters have to share on this as well.
I can weigh in on that a little bit, Lisa and Matt. If we look at people who are aging, then there are four components that are required. So there isn't just one activity that one can do to address that question. But the four components would be some form of balance training, which is similar to what Carolyn has been speaking about, an understanding of flexibility or improved flexibility, some form of strengthening, and then an aerobic activity. And these would be the four components that certainly somebody who's aging like I am would need to include in their activity. If there was one sport that I would recommend, it would be swimming, because swimming allows you to use most of your muscles. It reduces the load on aching, injured joints. And as long as you build slowly and carefully, you're less likely to injure yourself unless you're trying to be a competitive swimmer. And they swim ridiculous loads, in my opinion. But that would be the one.
Okay, I think we'll move on now to our next question. And for this one, I think we'll ask, actually, Dr. Jordan, if we could come back to you for a quick one here on what are your thoughts on Prehab?
Well, I mean, I think this might come back to, what is best practice telling us versus maybe what the science is telling us. And just to kind of orient everybody to what my definition of what Prehab would be is Prehab would be the stuff you do before you get hurt that hopefully keeps that next injury away. And I think there's a good amount of science to support that. For example, with our tendons grow just like our muscles do. Believe it or not, they can hypertrophy, they can get bigger. And when our tendons get bigger and stronger, they can handle more load. So there's an example of, where a prehab for your tendons to prepare your body for the marathon you're going to run and to make sure your Achilles and tendons are nice and strong and ready to go. There's examples there where certainly it's effective and I think very worth considering. And I'll just add in one more final comment here, and maybe Dr. Emery will have some thoughts. Is that this idea of neuromuscular training? A couple things, when we talk about these neuromuscular warm-ups and neuromuscular training programs, a few keys. You're doing this before your activity, right? So it's not just doing yoga at night. What we're talking about, this is something that's targeted. It's about 15 minutes long, roughly, I would say. It's often thought about in terms of what are the injuries that are in the sport. So it's very specific to preparing the body for what's about to come. And it's not there to make you super tired, right? And it's not like training like you would go to the gym and train. It's there to actually prepare your body for what's about to come. And, I don't want to steal the thunder of these injury prevention studies because, I always quote Dr. Emery, but I think conservative estimate is that it can reduce injury by 30%, roughly, spending 15 minutes. So, when we talk about prehab, I would say, absolutely, it's something I would do. And I think the science would suggest is a thumbs up. So spending some time on that before you exercise and do the things you love.
Dr. Emery, I think I'll come to you now because following up on the neuromuscular training, those protocols, can health care providers, can they use those in the community?
Yeah, I think everybody can use that in the community. We deliver some workshops that are available to coaches and teachers as well as clinicians out in the community. And I think building on some of the things that Matt said, certainly sport specificity is important. It's important to kids and their parents, and it's important to coaches. So I think that we need to think about the context in which these programs are being delivered to youth, and making sure that workshops are available for those that could deliver those programs, such as the coaches that are working with those teams every day. And I just wanted to add one other comment, and that is, it's some people believe that the notion of prevention is something, well, we need to do all of this before the season starts. And actually, the prevention program goes throughout the season. It progresses through the season. Each activity and exercise within neuromuscular training can also progress in difficulty, and that combined with thinking about training load, we really have a nice program that's specific to the sport sport and across multiple contexts to consider when we're thinking about keeping kids ready to participate. And that can change in different sports, and obviously will change in progression coming off COVID.
Excellent. Great intel there. Thank you. Dr. Minocha, where is there support for the proper use of a cane? Where can people access that support?
Yeah, great question. I mean, I'll give a little plug for our app. We do have skills on how to fit and walk with a cane. It's kind of hard to walk.
I can walk.
https:/icanwalk.info. Check it out. It's free. Yeah, that's the problem. A lot of these things aren't included when you get a cane, but if you're able to access a physical therapist or an occupational therapist, and the Red Cross also has some nice handouts on learning a bit more about how to use and walk with a cane.
Great, thank you. And now a question for our two-time Olympian, Danielle. How do you, share some of your the journey that you went through? How do you approach, other athletes to respect their bodies? And I guess that concept of the slower return to sport. So how did you, or would you have reacted to this advice? If you had received the advice of, really respect the process, you actually have to, take more time when you're just itching to get back there.
Yeah. Well, I mean, you have to follow the medical people's advice, right? And so for me, that's what I did. I wasn't wrestling's hard. Dr. Jordan was saying all the research is about ski jumpers that he's doing. And so for me, when I was talking about going back from my ACL injury, there's no real progressions to follow on the wrestling mat. And there's not very many doctors or medical people who are skilled in wrestling specifically. So for me, it was I had to make my own plan with my coach and with my surgeons. Both my surgeons actually gave me their input too. And so I was pretty confident in what I was doing just because I was, making a plan with them. But for me, again, I was on a real time crunch because of the Olympics. And so I was fast and probably too fast in my comeback. And I think that if I didn't have that Olympics, or even if I had more time to maybe try again for the next one, if I wasn't so old, maybe I would have given myself a little bit more time. But I think that, again, we know there is a way higher chance, of re-tearing your ACL after you have a first one. And we all know that, we're told that. And so I think that you just have to tell athletes that it's not just about your performance, and it's not just about medals. It's about your well-being after. And so life is more important than any sport or any medal. And I think when you're an athlete, it's kind of hard to actually understand that and believe that. But I think just encouraging athletes to really, really think about that and really understand that that's true and that's the case.
Thanks, Danielle. Well, following up on that, Dr. Emery, what sports for children would you recommend that would be good for lifelong injury-free activity? Of something that might be a good one to encourage. So for those parents out there that are looking for something that maybe would be that long-term, less injury risk, what do you recommend?
Well, I'm gonna shift the question slightly because we're not going to get kids who are playing football and rugby to join the track team as a general statement, right? We want to really think carefully about getting kids playing the sports they love and as early as they can and lifelong sport participation. So I would argue that we need to think about things such as early sport specialization. Perhaps in some sports we don't have it right. Perhaps we're specializing too early, and kids aren't getting that all-round sport experience that we used to get many years ago. I won't say how many years, but I think certainly it's important to consider multiple sport opportunities for kids and get that what some call the cross-training effect between sports. And I'm a huge proponent of swimming. I still continue to be in the pool. It's the one sport that I can continue to perform at an older age. And I think that that's important to be thinking about those alternatives as we do move through the various youth and early adult years.
Very good. Thank you. Yes, the multi-sport approach. And Dr. Motati, still with the youth aspect, I guess, of our discussion here, what is the youngest age? One of our participants would like to know the youngest age that you have seen an ACL tear in an athlete, youngest athlete you've come across that.
8 years old.
8. I'm in shock. Wow.
I can't emphasize enough what Carolyn just said.
Oh,
Because if you look at professional athletes, the ones that participate in multiple sports when they're young are more likely to be successful in professional sport. So it isn't just about injury prevention. It's about performance and success. And the idea of specialization at a young age is probably leading to the great increase in injuries such as ACLs that we're seeing right now. I can recall in high school and university, and my wife played varsity basketball for 5 years. And she couldn't think of somebody that she played with that had torn their ACL at that level. You can't find a varsity basketball team in Canada right now, probably without 2 or 3 women who have torn their ACLs. So I know it sounds shocking that 8 years old is the youngest, but it's all the way through all sports and young kids now. It's a big deal.
So you're seeing an increase in that then at that young age?
Not so much at that age, but certainly what happens is that the young kids are able to adapt. The teenagers are not. And so it's the teenagers and the young adults where we're seeing the highest risk of ACL injury in particular. And I'm sure Carolyn would give you a lot of stats on all of the other injuries too, which, well, concussion, of course, we heard about.
Mm-hmm. Thank you, Dr. Motati. And actually, I'm going to stay with you and then maybe Dr. Jordan, if you can also follow up after Dr. Motati. Many people are wondering what is the best way to recover from a knee or hip replacement? Dr. Motati.
Well, let's go back to the Prehab question, because my interpretation of Prehab is preparing yourself before surgery. And so the best way to recover is to be prepared before you go in. And it's so important for this type of surgery, whether it's weight loss, whether it's strengthening, whether it's understanding what you need to go through afterwards. So I think for hip and knee replacement, the GLAD program that might allow you to delay that procedure, number one, and the strict Prehab before surgery, number two, will allow you to recover much better after those operations.
Dr. Jordan?
Yeah, no, full disclosure, this is completely out of my scope. But I'll just maybe, piggyback off of what Dr. Motati's saying from the standpoint of, if there's anything we can draw from the world of sport performance where athletes go in for a big surgery like an ACL reconstruction, and what again I think practice suggests, and what we see in the science is that it absolutely has a big bearing. What you go in with, what you go in with in terms of your strength and your function before something like that has pronounced effects on how you do after. And so I can echo that whether it's probably a good generalizable rule, to get yourself as strong and physically prepared as possible for a hip replacement or a knee replacement, and be ready for all that entails.
Thank you very much. Our next question is for Danielle. Can you share more about your experience with both the physical and mental recovery? Do you have any resources that you would suggest for athletes to prevent injury or return from injury? So is there anything that you could share in that respect?
Obviously, I haven't been able to prevent my own injuries very well, but in terms of coming back from injuries, I think that I don't want to talk for other people, but probably every athlete, the hardest part is not the physical part of coming back. It's the mental and emotional part of coming back from a major injury especially if you're in sport, because, you're missing out on practicing, going to tournaments and doing what you love and being around people that you love. And so I think it's just, listen to your doctors, listen to your physiotherapists, do the work, do the physical work, but also do the mental work. Continue to, seek help when you need it. There's a sport performance or psychiatrist or psychologist. I've had to, use those kind of resources myself, all the three injuries that I've talked about. So yeah, I think just doing what they tell you, listening to your body, and knowing that it's not going to be a linear recovery process. You're going to face some setbacks no matter who you are or what the injury is, but you're going to come out the other side. And as long as you, listen and do the work.
Thank you. Well, this is one I like this question because it's been on my mind as well. Here we are, Dr. Jordan. We hear from money-making corporations such as Fitbit, how many daily steps that we should take is, the standard being 10,000. Is this based on any science, particularly for aging or injured folks? How many steps per day is ideal for someone over 50? And what about for other age ranges? I mean, is 10,000, is that the benchmark or is that a Fitbit benchmark? Can you give us some insight into that, please?
Yeah, no, I'm afraid that the science underpinning that notion is equivocal. Let's just say, I mean, what there is evidence for, and I think Dr. Menosha kind of nailed this one, right? Is being consistent with what you can do, and the evidence is there for the consistency. That it doesn't have to be, to get benefits. It doesn't have to be that I put in the 10,000 steps, I did the 10-kilometer walk, I did the 6-hour workout, this idea of, small, frequent dosing of exercise has a really big pronounced effect on our longevity. And yeah, certainly the 10,000 steps is not something that I necessarily think a tree that we're putting our ladder against, so to speak. But let's look at some recent evidence that's come up about the importance of standing up during the day if you work at a desk. Like literally getting up and moving around and not sitting there. Those things have big effects on our health. So I might shift away from the lofty goal of 10,000 steps to starting to do more measurable, manageable, small things. Small things make a difference. So that would be my view on that. Very
good. Thank you. Consistent with your steps. Okay, well, let's see, I have 3 here in front of me, and this will be, I guess, our last question. Okay. Dr. Emery, can you talk about, the higher risk for injury or re-injury after an initial injury? Does it apply to other injuries? So in this case, they're wondering about plantar fasciitis.
Yeah, I'd say that there's certainly quite a bit of evidence across multiple injury types and irrespective of injury type that leads to greater risk of injury or a second injury. So, for example, even in the concussion literature, those that have had a previous concussion seem to be at a greater risk of a musculoskeletal injury to follow for a lot of different reasons that may relate to being prepared to return to play. And so I think that we need to think about the rehabilitation following an injury for secondary prevention of recurrent injury in a similar way to thinking about preventing the first injury for sure.
Okay, great. We have time for just a quick follow-up. Is it important to vary the exercises in your neuromuscular prehab routine from time to time, or is it okay to use the same sequence before games and practices?
Well, I think it depends on what you're using it for and at what level of play. So there's a lot of different components there for sure. But arguably, having components that across those four areas has been described within neuromuscular training, and as Dr. Matadi spoke about as well, is really important. And progression throughout the season is important as well. So I think it's about not just doing one thing, and really being prepared to participate and thinking about it from that context as well.
Very good. Well, thank you so much to all of our presenters today, as we are going to now wrap up the 2021 Wood Forum. And we want to especially thank all of you for attending today's event, and a very extra special thanks to Dr. Donna Wood and her family and the Wood Joint Research Fund for the ongoing support that allows us to continue these great public events. Now, if you would like to learn more about how you can support this and other cutting edge research that takes place at the McCaig Institute for Bone and Joint Health, please contact the Institute at mccaig@ucalgary.ca. Lastly, you will all receive an online survey in the next few days about our event, so please do fill it out. We would greatly appreciate the feedback. So thank you again so much on behalf of everyone on our panel, all of the organizers for this event. Want to thank you so much for joining us. And to quote Dr. Jordan from earlier in our discussion today, exercise is the medicine, my friends. Exercise is the medicine. So I hope you have a great rest of your weekend and enjoy the sunshine wherever you are. Thank you. Bye-bye.